Hi guys, Avi here from Precision Physiotherapy and Hamilton Physio and Rehab. Quickly wanted to talk about the top 3 exercises that we can do no matter what the cause is for your knee pain. So first one is very simple, sit to stand. It's all about the mechanics of your knee when you do this specific exercise. We do this all day long. However, when you want to do this as an exercise, there are certain things that you want to take care of. So very simple, to make sure that your knees are out and feet is straight. So a common saying goes is that the edge of the outside of your knee should match to the edge of the outside part of your feet, like pinky toes. Second thing is when we lean forward, we do not want to lean forward ahead of our nose on toes. So you want to go up to this point but not too far forward. So common mistakes that a lot of people do when they do a sit to stand is that this toe would go out. So when we do that sort of a movement, of course that's a compensatory technique people tend to do to get good base of support that if they're dealing with some balance issues, but that puts a lot of strain on the knee. Another thing that could happen is this knee going inside like this and it collapses and it puts a lot of strain on the inside part of the knee, and then the first few steps are a little wobbly when you do that. So in order to avoid that, just to make sure that your knees and toes are straight, 10 to 15 degrees of outside of your toes are good, and then either you can have your arm by your side, arm across your chest, or even if you need some support to begin with, but the idea would be to stand just like that, and then very similar concept. When you go down, you want to make sure that this knee is not collapsing in like this and putting strain. You want to stay out like that, squeeze your glutes, and then slowly lower down. That's the first one. Second one, I call that as a bridge. Laying down in this position, what you want to do is digging on your heel and then lifting this hip up. Now when you do that, you want to squeeze your glutes. Now if you just keep it at this point, the muscles are not activated as strong, and there's a difference between the hips being here and then the hips being here. You want to get this hip as high as possible just to ensure that you're not straining your back while you do that. So keep that very strong squeeze in your glutes while you do that. And slowly lower down. So 10 to 15 repetitions of this specific exercise ensures there's strength in the glute muscles, and that puts takes away a lot of stress from your knee when you're walking. The third exercise, I call them as a clamshell. So just being in this sort of a position, what you want to do is you squeeze your heel and then you want to raise this up. So a common thing, making sure there's not a lot of range of motion here while you do that. It's important that we keep our hip thrusting a little forward. One of the common mistakes that we often see is that just to get more range of motion, people tend to just fall this out. So you want to make sure that you keep this nice and straight. Your elbows can use this as an indicator of how straight you are, and then just if you do it right, you will feel a strong sort of a contraction over to the side. You can always use a resisted or a TheraBand just to add a little more challenge and difficulty, and that's going to strengthen this outside part of your hip, and that's going to decrease the strain on your knee while you do this exercise. Now if at all it hurts, okay, and the common saying goes that if it bothers you, you got to find a modified way to do that exercise, or probably stop and then speak to a health professional. But then just adjusting the knee position, getting the feet back a bit or getting the knee up could oftentimes make it a little easier. So give these 3 exercises a try and let me know how that goes. Talk to you soon.